Summer means lots of outdoor activities, which also means prime season for Lyme disease, the most common tick-borne ailment in the U.S. And while it can be treated with antibiotics, 10 to 20% of patients suffer a wide range of symptoms, including severe muscle pain and cognitive difficulty that can last for years. Dr. John Aucott is director of the Johns Hopkins Lyme Disease Clinical Research Center, which opened in April to study what is known as post-treatment Lyme disease syndrome. Welcome, Dr. Aucott. We understand there are 300,000 new cases of Lyme disease per year. What is causing the ramp up?
Well, Lyme disease is spread along the eastern seaboard, really from its start in Lyme, Connecticut, all the way up to Maine and down into Virginia. And that's because of the ecology that's favored the mice and rodents and deer that promote the tick populations and the spread of the bacterial disease that's carried by actually mice and small rodents.
And why is it so hard to identify the initial onset of Lyme disease? It's been hard to diagnose in the past.
It can be very tricky if people have the skin lesion, the erythema migrans rash. It can be easier, but even that is difficult because it's not always the classic Target store ring within a ring bullseye. Sometimes it is mistaken for a spider bite or bug bite, and not everyone has that skin lesion. Some people just have a fever and an unusual illness that they chalk up to a virus or another non-specific infection.
But see, that's what terrifies me as a parent, because if my child has a tick bite, but I don't actually see the tick and there then is no rash, there's no way of knowing they've been bitten, correct?
Well, it's being vigilant for fever and signs of infection, and then keeping a close eye on the child. If you suspect they might have been exposed, if they're out in an area where there are a lot of ticks, then it pays to be vigilant. And of course, the first protection is looking for ticks and getting them off before they have a time to transmit the disease.
But if a few days go by and there is no fever and there are no other symptoms, then you're pretty much out of the woods?
Well, you really have to watch for several weeks, actually. The incubation period between the tick bite and the first signs of infection is typically a week or two, so it's really watching for several weeks. It's really being vigilant during the spring and early summer months when there are a lot of Lyme disease is transmitted, really May, June, and July as the prime season.
And how long do we have after that tick bite to attack the Lyme disease bacteria before it really spreads?
Well, it really takes 48 hours for the majority of the cases to move the bacteria from the tick to the person that's been bitten. So again, in the first 40 hours, you want to get the tick off. That prevents the majority of the cases. They never are transmitted. But then if it is transmitted, you want to treat in the first several weeks to month. That's the early stage when Lyme disease is most easily treated. So we don't want to miss that chance to make the diagnosis in the first several weeks after the tick bite.
And it is fairly easily treated then with antibiotics, correct? I do have a question though, doctor. Why is it that some people seem to overcome Lyme disease with treatment better than others? Is there a genetic component to how hard we will get hit by it?
Well, that's exactly what our Lyme Center is investigating. It's why that 10 to 20% of people remain ill compared to the 80% that get better. We think it has to do with the immune system response to the infection. And some people, as you said, may be genetically destined to have a good immune response, and other people destined to have an ineffective immune response. So we think it relates to the immune system's response to this bacterial infection. And that is what leads people down one of these two different paths.
And very quickly, we hear that the military has developed gear or protective clothing that repels ticks. Is there any chance this might be available to the general public soon?
Absolutely. It's called permethrin, and it's sold in hiking and sporting goods stores, and that's what the military treats their clothing with. Permethrin's not for skin, it's for clothing, and it is sold in stores, sporting goods stores, and with the advice of your doctor or pediatrician, that could be a very effective way to prevent ticks from getting on you in the first place.
Very good to know. Thank you so much, Dr. Aucott, for that.